Overview. Attention Deficit Hyperactivity Disorder, ADHD, is a neurodevelopmental disorder that affects both children and adults. It is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with daily functioning and development. ADHD is one of the most commonly diagnosed mental health disorders in children, and its symptoms can continue into adulthood. Types of ADHD. The American Psychiatric Association, APA, classifies ADHD into three main types based on the dominant symptoms. 1. Predominantly inattentive presentation, ADHD-PI. Difficulty sustaining attention. Easily distracted by external stimuli. Trouble following instructions or completing tasks, frequently losing items, e.g. keys, school supplies, forgetfulness in daily activities. 2. Predominantly hyperactive impulsive presentation, ADHD-PH. Constant fidgeting or restlessness, excessive talking or interrupting conversations, impulsive decision-making without considering consequences, difficulty waiting for turns in conversations or activities. 3. Combined presentation, ADHD-C, a mix of both inattentive and hyperactive impulsive symptoms. The symptoms must be persistent for at least 6 months and significantly affect academic, occupational, or social life. Causes and risk factors. The exact cause of ADHD is unknown, but several factors contribute to its development. Genetics. ADHD tends to run in families, suggesting a hereditary component. Brain structure and functioning. Studies show differences in brain regions associated with attention, impulse control, and executive functions. Neurotransmitter imbalances. Dopamine and norepinephrine, which regulate attention and behavior, may not function properly in individuals with ADHD. Prenatal and early life factors. Premature birth, low birth weight, exposure to tobacco, alcohol, or drugs during pregnancy, environmental toxins like lead exposure. Symptoms in different age groups. In children, ages 3-12, difficulty focusing in school, impulsivity, blurting out answers, interrupting conversations, trouble completing homework or chores, constant movement and restlessness, difficulty following rules and routines. In teenagers, ages 13 to 18, poor time management and organization, struggling with self-control and emotional regulation, risk-taking behaviors, reckless driving, substance abuse, trouble maintaining friendships and relationships. In adults, chronic procrastination and disorganization, difficulty managing work responsibilities, forgetfulness and poor memory, impulsivity in financial decisions, relationship struggles due to inattentiveness. Diagnosis of ADHD. ADHD is diagnosed through a comprehensive evaluation, which includes clinical interviews. A doctor or psychologist gathers a detailed history of symptoms. Behavioral questionnaires, standardized ADHD rating scales are used for assessment, medical examination, to rule out other conditions that may mimic ADHD symptoms. Treatment options. ADHD can be managed through a combination of strategies, including 1. Medication. Stimulant medications, most commonly prescribed, e.g. methylphenidate, amphetamines, help increase dopamine and norepinephrine levels. Non-stimulant medications, used when stimulants are ineffective or cause side effects. Examples include atomoxetine and guanfacine. 2. Behavioral therapy. Cognitive behavioral therapy, CBT, helps with emotional regulation and impulse control. Parent training teaches parents strategies to manage their child's behavior. Social skills training improves communication and interaction skills. Lifestyle and home strategies. Creating structured routines, using reminders, planners, and organizational tools, encouraging physical activity and a healthy diet, practicing mindfulness and relaxation techniques. ADHD and special education. Children with ADHD may qualify for special education support under laws like the Individuals with Disabilities Education Act, IDEA. Schools provide accommodations such as extra time on tests, preferential seating in classrooms, breaks during long tasks, one-on-one support from teachers. Conclusion: ADHD is a lifelong condition that requires ongoing management, but with proper treatment and support, individuals with ADHD can lead successful and fulfilling lives. Early diagnosis and intervention are key to improving outcomes for children and adults with ADHD. Would you like a simpler version or specific information related to special education and ADHD? Here are 5 examples of ADHD in different situations. Har. 1. In a classroom, inattentive type. A 10-year-old student, Rohan, frequently forgets to bring his notebook to school and struggles to complete assignments. He often stares out the window during lessons and misses important instructions, even though he wants to do well in class. 2. At home, hyperactive impulsive type. A 7-year-old girl, Ananya, is constantly moving, jumping on furniture, running around the house, and talking non-stop. Even when her parents ask her to sit down for dinner, she finds it hard to stay still and often interrupts conversations. Hashters 3. In social situations, impulsivity. A teenager, Aryan, frequently interrupts his friends while they are talking. He speaks out of turn in conversations, blurts out answers before the teacher finishes asking a question, and often acts without thinking, which sometimes leads to conflicts with his peers. 4. At work, adult ADHD inattentive type. A 30-year-old professional, Priya, struggles to stay organized at work. She forgets deadlines, loses important documents, and finds it difficult to focus during long meetings. Despite being talented, she often procrastinates and feels overwhelmed with tasks. 5. While driving, impulsivity and distractibility. A 25-year-old man, Rahul, has trouble focusing on the road while driving. He gets easily distracted by his phone, music, or passing billboards. He often speeds up impulsively without noticing traffic signals, which has led to multiple traffic violations. These real-life scenarios show how ADHD can impact different aspects of life. Do you need more examples related to special education or managing ADHD? Got it. Here's your updated promotional message. Support special education awareness. Hello, everyone. I'm Vikas, the creator of Special Ed Hub, where I share valuable content about special education and the needs of children with disabilities. My mission is to raise awareness so that everyone understands and supports inclusive education. If you care about empowering special children, if you want to learn more about special education, and if you believe in education for all, please like, share, and subscribe to Special Ed Hub. Together, let's build a more inclusive world. Would you like any tweaks or additions?